I was in not great shape, and we have a medicine that healed me, that fixed me. It's a great medicine. People are going to get immediately better, like I did. I mean, I feel better now than I did 2 weeks ago. It's crazy. And I recovered immediately, almost immediately. I might not have recovered at all. I'm just saying that we have something that will cure this now, and a cure.
It's been less than 10 days since Donald Trump tested positive for coronavirus. And this afternoon, the president, who still may be contagious, will hold a rally on the south lawn of the White House where he'll address the crowd from the Truman balcony. The White House says guests will be instructed, but not required, to wear masks. And on Monday, Trump will board Air Force One to Florida for another rally. There are still a number of unanswered questions like, has Donald Trump tested negative since his release from Walter Reed? Trump says it's in the works.
I heard you said you were going to test again today. Have you been retested?
I have been retested, and I haven't even found out numbers or anything yet, but I've been retested, and I know I'm at either the bottom of the scale or free.
When is your next test going to be?
I don't know. Probably tomorrow, Mark. They test every couple of days, I guess, but it's really at a level now that's been great to see it disappear.
But we still haven't seen the results of that test or heard from Trump's doctor since Thursday. CDC guidelines recommend 2 consecutive negative tests before leaving quarantine. Joining me now, Dr. Robert Wachter from the University of California at San Francisco, MSNBC medical contributor Dr. Nahid Bhadelia, and MSNBC science contributor Laurie Garrett, author of The Coming Plague. Dr. Wachter, I'm going to come to you first, but before that, Speaker Pelosi was on The View this week, and Whoopi Goldberg asked her if she would go to the White House to, do negotiations with the president over a stimulus package. Take a listen to what she had to say.
Is it time to pick up the phone? Do you want to go over to the White House? What's the best way to work this out now?
I wouldn't go anywhere near the White House. It's one of the most dangerous places in the country.
I mean, Dr. Wachter, she's not wrong, right?
She's not wrong. It's the site of a super spreader event. You have several people we know who are or were recently infected. And even if the president is getting toward the end of his period of infectivity, there's a lot of virus that was hanging around there. And so it's not at all impossible that other people have infection and we haven't heard about them yet, and have them all milling around together at close distance with no masks is pretty shocking.
Dr. Bhadelia, do you believe that the president is cured, that he no longer has the virus after such a short period of time?
Well, Jonathan, the studies that we know that have come out in terms of the ability of people to transmit this disease at the end of their illness, if they have severe illness, we know that they could be shedding this virus for a longer period of time. And the most recent study in August said at least 15 days. After 15 days, it might go down. And that's why the CDC says that those who've had a more severe course, which per the president's own testimony, he had a pretty severe course at the beginning of this, he could still be shedding the virus. And the thing that sort of shocks me is that we have an administration that had a super spreader event, only recently. It was lackadaisical in their contact tracing around it. We have a president who insists, while he may be contagious, to become the modern Mary Malone, which is AKA Typhoid Mary. He wants to continue having these events where he might be spreading this to others. We have other members of his party. Lindsey Graham is refusing to take a test to do a Senate debate with his contender on stage because he's afraid he might be negative. And I want to go back to what Kimberly Atkins said before the break, which I think the whole thing it's a bid to undermine the severity of the pandemic, which has already killed over 200,000 people in this country.
Dr. Bhadelia and Dr. Wachter, if you want to jump in on this too, is the president fooling himself? Is he feeling great and feeling fantastic because he's on steroids and not because of the therapies that he's been taking? Dr. Bhadelia, then Dr. Wachter.
Yeah.
Yeah, I don't think it would be uncommon. I mean, we've seen a couple of patients where we've discharged them where they look great and they end up getting readmitted because that 1-2 punch where the immune system aspect of this disease is infection, where, the virus sort of makes the immune system have a maladaptive response, kicks in and people do end up getting sick. And so as the president's physician said, I don't think he's out of the woods until we see him fully recover.
Mm-hmm. Dr. Walker, I know you wanted to get in. Mm-hmm.
Yeah, he's according to the president, if he's to be believed, he's off his steroids, so it should no longer be accounting for how he feels. He may come crashing a little bit because people often feel quite good when they're on steroids, even if their disease is raging. When he said, "I feel 20 years younger," there's nothing about COVID that makes you feel 20 years younger. So that was probably his steroids speaking. But according to him in the interview yesterday, he is off all of his meds. And the normal time course of the treatment with the steroids would be that he would end it today. My guess is his doctors probably ended it a day or two early.
Lori, let me bring you into this conversation. Feel free to add your thoughts to what was said, but I want to get you to pick up on something that Dr. Wachter said at the beginning of this conversation, and that was, the White House was the scene of a super spreader event. Another one's probably happening today, but that some of the virus could still be hanging around the White House. Talk more about that, and how worried should people be that maybe even if the president is no longer shedding the virus, that some of it could still be around? Is that even possible?
Well, first of all, let me just say what a privilege it is to be with these two tremendous doctors. And Bob in particular has been having public grand rounds that you can watch online where the expertise of UC San Francisco is available for everyone to see. It's a marvel and it's a wonderful thing that you're doing. And one of the things that kind of came through in the most recent grand rounds that Dr. Wachter hosted is how crucial it is that we don't actually know when the president first got infected. We have widespread speculation that it was at the Rose Garden on September 26th, and so then we project outward from that day each course of his events and of events in the White House. But we're all running a bit blind because the White House has refused to let the CDC in to do a thorough investigation. We've not been allowed to have any further details on the other 34 cases reported to FEMA, and that makes it hard for us to know how does this illustrate the risk level associated with the president's campaign activities going forward for the next 24, 25 days. And that makes it very difficult for those of us who aren't in the White House. They're looking at video images such as you're showing right now, looking at images of the president that he wants released, which we now know he rehearses, that we're not actually seeing the first image, we're perhaps seeing the second or the third take. And from all these, trying to read tea leaves, it's almost completely impossible. And I also want to say one thing about Regeneron. The president has been receiving this, he was receiving such a massive cocktail that it's very hard, I think, for any expert to tease out from afar which element of that cocktail played the crucial role in however well he feels right now, and what going forward without any of the medication the president is likely to experience. Regeneron is a thoroughly experimental treatment. It's very promising, and the president is not wrong to promote it. But it's experimental. We're still trying to understand how it affects the human body. And one of the things that's going to be going forward, I think I'd like to ask the two physicians aboard, is going to be really tough for us to understand is, has the president actually made, his own immune system made any neutralizing antibodies? Or are we simply seeing measurements of the Regeneron monoclonal antibodies in his blood, in whatever samples they're drawing, so that conclusions are being drawn that the president is now, and he has said himself, quote unquote, immune. But is he immune, or does he simply have some final lasting monoclonal antibodies circulating in his body that have fought off the virus and have protected him, but he's not immunized at all? He never did generate his own immune response, and therefore he could potentially be at risk in these crowd settings. He could potentially be reinfected.
Well, Dr. Wachter, jump in here. After listening to Lori, I'm sitting here thinking, you're from what I understand, the expert on Regeneron. But talk more about the president's therapies and how widely available are the drugs and medications that the president took available to the more than 7 million people who have now contracted COVID-19?
Well, first of all, thank you, Lori, for the shout out. I really appreciate it. And let me clarify one thing, Jonathan. I don't believe that people would be getting the virus from the White House in that it's sitting around on a table. I think that's become clear that that's not a major route of transmission. I am concerned about a chain of transmission that the people we know who have gotten it may have given it to others that we don't know about, and they may be milling around the White House at a different stage of infectivity than the president. So that's the concern. In terms of the monoclonal antibodies, no one can get that right now other than being enrolled in a clinical trial where you have a 50% chance of getting a placebo. Now, just to take this idea that that is what cured him, as Lori said, we have no idea. It could have been that, the other two medicines he got, or luck. And in fact, when he first was diagnosed, given his age and being overweight, he had about a 95% chance of getting through this. So a 5% chance of dying when he was first diagnosed. If he'd gotten placebo, he would be out there, I guess, touting placebo as a miracle cure, because 19 times out of 100, he would have survived this. So if the monoclonal antibodies worked really well, maybe it lowered his mortality rate by a couple of percent. We don't know that yet. It's still early in the studies. That drug is not available to you and me. The other two drugs are, and most people who are sick enough to get into a hospital, assuming they have health insurance, would have gotten the other two drugs if they were very ill. One final point is we should recall that prior miracle cures touted by this president include hydroxychloroquine, now demonstrated to be ineffective and actually slightly harmful, convalescent plasma, where the jury is still out, bleach, enough said, and the virus, which was going to disappear like a miracle. So we should take it with a very large grain of salt when he touts this as the miracle cure.
Dr. Badil, I'm going to end the interview with you. Let me have you take a listen to this mashup that we have of people sort of resisting answering the question about when the president's last negative COVID test was.
Do you remember when he had his last negative test?
I don't want to go backwards.
When was the president's last negative test?
I can't reveal that at this time. The doctors would like to keep it private since it is private.
Have you been tested recently?
Maybe. Yeah, I just saw the doctors today. They think I'm in great shape. I'm in great shape.
Did you test negative?
And I'll tell you, I took this Regeneron. It's phenomenal.
So on that last negative test, she says you said you don't have that. You don't know, or you don't want to say?
So we don't have that. I don't personally know.
Dr. Bedelia, we've got less than 30 seconds left. Why is it so important that we know when the president's last negative test was?
Well, Jonathan, there's clearly a resistance in declaring that. That means that there's a concern that he may have been positive earlier than we know. And that's a concern because if he was positive earlier, then there might have been a longer period of time where he may have been contagious to other people. And it's critical because just as with the president, as with others, as Dr. Walker said, who may have been positive, we need to ensure we get in contact with everybody else who might have been exposed, a portion of those who may now have the disease, who may now be exposing other people.
And with that, we're going to have to leave it there. Dr. Robert Wachter, Dr. Naheed Bedelia, I'm so sorry, and Lori Garrett, thank you very much for coming on the show today. Next up, Trump expands his lock 'em up list. We'll be right back.